Good morning to those joining us in Europe, and good afternoon to everyone in Asia. Welcome to Asia House Research Briefing. My name is Sucha Mao. I'm the Head of Research and Advisor here at the Institute. For those who are not familiar with the works of Asia House, we are an independent think tank and advisory service based in UK, London. We work with companies and governments in Asia, the Middle East, and Europe, facilitating high-level dialogues, providing business and market intelligence, and driving commercial outcomes. It is with my great pleasure to welcome you to our research briefing. For today, our Asia House Fellow, Aarthi Raghavan, will be presenting the key findings in her recently completed fellowship report. It is a timely piece of research that examines the current impact and the future potential of cross-border sharing of health data on health innovation across 5 Asian countries, which are China, India, Indonesia, Malaysia, and Singapore. The report has also identified the main barriers to cross-border data sharing in Asia. This report is accessible on our Asia House website. Just a few housekeeping rules before I turn the floor to Aarthi. To be clear, today's research briefing is on the record and it will be recorded. We welcome your participation in today's research briefing. So if you would like to ask a question or make a comment, please put your virtual hand up and we will come to you after the presentation. Also, we would like to encourage you to have the video camera on to facilitate our discussions. It is with my great pleasure to invite our fellow Aarthi Raghavan to speak more in details about her report. Aarthi, over to you.
Good morning to everyone from Europe, and for those in Asia, good afternoon and good evening. Let me briefly share my screen and start the presentation. I've been working on this research paper for the past 1 year. The topic of my presentation today is Asia's digital health innovations and the role of cross-border health data sharing. To begin with, I'll give a brief, start with a brief outline for the presentation. Today, we'll be talking about health data sharing in general and what are the drivers and barriers of cross-border health data sharing in Asia. And we'll then delve deeper into the national health data sharing infrastructures in Asia across 5 Asian countries, as Ochin had mentioned. And we'll see how it shapes digital health innovations in Asia. And towards the end, we'll discuss some of the future directions for digital health innovations in the region. To begin with, health data sharing is the access, exchange, integration, cooperative use of data across organizations, regions, or countries to optimize the health of individuals and populations. So we have to understand this broader scope of health data sharing to begin with. And why is it so important in this day and age? Because health data sharing is known to have a significant impact to enhance the quality of healthcare services across the world, and especially so in Asia. It is important in improving health research effectiveness since it gives researchers access to a wider set of data. It also is very important given that today digital data is the new oil, as we say. So health data sharing, particularly in the digital scope, helps shape digital health innovation significantly. And for governments, data sharing helps in improving policy making and addressing several gaps in the healthcare sector. Now, to understand health data sharing, which is also known as health data interoperability, there are 4 layers of the same as defined by the Healthcare Management and Information Systems Society, HIMSS, which is a popular American nonprofit. They have defined it as, firstly, foundational interoperability, which basically means establishing base connectivity requirements between 2 systems for them to share health data. Secondly, is structural interoperability, which defines the data's format and syntax so that it is shared consistently across 2 systems. The third is semantic interoperability, which sets the requirement for the interpretation and use of health information such that it makes sense and it is understandable equally and consistently across systems. And the last is organizational interoperability, which basically covers health security, governance, and social and legal considerations to enable a trusted exchange of data across systems. Now we'll delve into the drivers of data sharing in Asia in the healthcare sphere. Firstly, countries believe that they want to have a common set of purposes for sharing. So these can be for public health emergencies, as we saw during COVID-19. Then it can be for the case of patient care, where a patient is moving from one country to the other to seek care. The third can be for research purposes to enhance medical research outcomes for Asia and globally. The second key driver for cross-border data sharing is to ensure the data privacy of for patients. Example, anonymization and encryption techniques have been widely recognized as key drivers for cross-border data sharing. There are other emerging techniques as well. Technologically, it's a fast evolving sphere. The third key driver is adoption of common standards for health data. This ensures that data sharing is effective and efficient and meaningful across countries. The last key driver is the need for a coordinating organization to orchestrate data sharing between organizations. At this point, this is a key gap. There is no current organization undertaking this task, but it is believed that if there is one, then it is a key driver. We now talk about the barriers, which is governments across Asia, they view themselves as custodians of citizen data, which leads to data localization norms, which they basically implement by means of data protection policies, and is also a clause kind of in cybersecurity policies at times. So what this leads to is that they want to ensure that health data is stored within their country, and they want to ensure that if there are foreign technology companies and startups operating collecting health data in their country, then they want to ensure that such companies partner with the local stakeholders so that they have better view of what kind of data these companies are collecting. A second key barrier is the emerging cybersecurity threat landscape, which is increasingly exposing healthcare, especially hospitals, to cyber threats in recent years. Hospitals across Asia have been experiencing this in recent years. And as a result, stakeholders are increasingly worried or hesitating from data sharing, so to say, because they don't want to take the blame when their own organization is facing a cyber threat. The third key barrier is the lack of a global framework on health data governance, which basically leads to a gap in terms of a common set of protocols when it comes to cross-border data sharing. This pushes several stakeholders to rely on national policies when it comes to data sharing in general. Now we'll delve deeper into the country cases. Firstly, to start with, we'll talk about China's health informatization roadmap. This particular roadmap has enabled hospitals to increasingly adopt health IT systems, to build regional information platforms, and to enable data exchange between them. And the government eventually plans to use emerging technologies to develop advanced innovations in predictive modeling, clinical decision-making, surveillance, and research. Now, this basically is beneficial and possible in China's case because 90% of the hospitals in the country are publicly funded, and as a result, the government has greater leverage when it comes to implementing policies. Despite years of implementation and consistent policy guidance by the government, there are still certain challenges in the context. Firstly, there are still data sharing gaps between primary and secondary hospitals, between provinces, as well as there continue to remain data privacy concerns across the ecosystem. Now, looking at the landscape, which is very interesting because given that the government is innovation focused, as well as in the private innovation ecosystem, there is less restrictions for domestic players. It leads to active competition in the digital health space, which has increasingly attracted global investments, as well as the startups themselves have been able to collaborate actively with hospitals to attract a wide variety of consumer-facing solutions in the healthcare space. Next, we talk about India's Ayushman Bharat Digital Mission. This mission was launched in 2020, and since then it has tried to build a unified health interface to which patients, providers, and facilities can connect by means of a digital application. The control of health data by means of this application remains in the hands of the user. The government is actively trying to onboard stakeholders to the platform by means of incentives, However, there remain certain gaps, especially the large private sector in India, which does not have adequate incentives to onboard this platform and to integrate their data with the platform. There is also friction at the state level implementation in India. Yet the Indian innovation ecosystem is fast growing. As we see increasingly in recent years, several unicorns have come up in the country, and the digital health space remains an attractive segment of startup ecosystem for investments. What the ABDM is basically doing is kind of becoming a facilitator between the public and the private sector. The public sector has huge gaps, structural healthcare gaps, and the need for solutions. And the startup is able to deliver on these solutions. So the ABDM wants to bring them together to the platform so that innovations can take shape by means of data share. Now we look at Indonesia's Satu Sehat initiative. This is a very recent initiative launched in 2022. The government aims to, Satu Sehat basically means One Health initiative. This initiative aims to digitize health data overall, enable health data sharing and improve healthcare services. Especially in the country, currently there are nearly 400 digital applications in the healthcare space alone, and that makes it very challenging for the government to get a comprehensive picture of the healthcare scenario in the country. So the government implemented this initiative, and it's very recent, so it's currently under implementation. The government has decided to for hospitals to integrate with the initiative by December this year, which is a very short timeline and also one of the challenges for the initiative. Secondly, there remain significant gaps in the Indonesian ecosystem, which makes it very difficult for hospitals to quickly integrate with the system. Moreover, there are speculations that will this initiative continue to be successfully implemented if there are leadership changes in the country. Now, coming to the innovation landscape, so to say, the government has been actively supporting innovation through the Digital Transformation Office. They recently launched a regulatory sandbox for telemedicine services, and they plan to launch, offer it to other types of digital startups as well in near future. In particular, the innovation landscape took off, especially during the COVID-19 time when hospitals increasingly work together with private digital health startups. And the government could see the real potential that innovation can bring to the healthcare system. So the country is currently pushing forward with the Satu Sehat to enable this ecosystem further. Coming to Malaysia, the government is currently implementing a comprehensive healthcare database across the country, which is known as the Malaysian Health Data Warehouse. It is one of the several initiatives the government undertook previously because the previous initiatives, many of them were struggling because of lack of funding or consistent policy implementation. So the government believes that the data warehouse will be able to overcome many of those challenges and bring together a comprehensive nationwide healthcare database. However, one of the key challenges that remain in this context is that the public and private healthcare are coexisting separately in the ecosystem, which means there is no active communication between the two systems in the Malaysian context. As a result, the government is finding it increasingly difficult to onboard the private hospitals to the data warehouse, and they are actively trying to do that by collaborating with different stakeholders. In addition to that, the Malaysian ecosystem has faced several cybersecurity incidents in recent years. And what that has led to is that stakeholders, particularly even citizens to some extent, are facing a trust deficit kind of in terms of data sharing. So they're not very comfortable sharing their personal health data with the government or with other startups. Despite this, the government is positive about digital health innovation and innovation overall because they have implemented a national technology and innovation sandbox known as the NTIS, as part of which the Ministry of Health has recently launched the Online Healthcare Regulatory Lab, Online Health Service Regulatory Lab, which aims to enable digital health innovations. Now, the government plans to provide adequate funding as well as capability support, including even physical facilities to enable this. Because recently they have identified 5 hospitals to develop them and further into health technology hubs under the sandbox. Now we come to Singapore's National Electronic Health Records. Singapore in particular has been implementing this since the 1990s. So which means they have significant experience, and the National Electronic Health Records has evolved significantly over all these years. So the records has become more comprehensive and has been managed very efficiently by Synapse, an organization under the Ministry of Health. It was previously known as the Integrated Health Information Systems, or IHIS. This organization is managing health data sharing under the healthcare cloud, which means all the data is on the cloud and healthcare stakeholders can access this data and share this data with the government, with the central database. Yet one of the key challenges for Singapore remain its vulnerabilities to cyber threats, because in 2018, the country saw a major cyber attack on its healthcare system, compromising personal data of more than 1 million citizens. So that led the government to rethink the need for mandatory data sharing of from hospitals to the NEHR. However, they have been trying to push forward with data sharing, and they are currently in the consulting phase of an upcoming health information bill, which aims to overcome many of these challenges going forward. Now, coming to Singapore's innovation landscape, it remains a bright spot in Asia in terms of digital health innovation, because the Singaporean government in particular has been implementing national level policies like the Smart Nation Initiative, the National AI Strategy, which has a dedicated recognition of digital health innovations as part of the policy. In addition to that, the Ministry of Health has also instituted the Office for Healthcare Transformation, which aims to develop and experiment with new innovations by collaborating with stakeholders. In addition, Singapore's rich ecosystem of academic and research institutions, alongside a well-invested and globally recognized private startup ecosystem, is kind of driving efficiently the digital innovation landscape in the country. Especially startups that launch in Singapore tend to have easy access to funding, resources, as well as talent. And this leads many startups to use Singapore as a launchpad to launch their services across the region. Now, based on these cases, we would now discuss the findings that emerge, which is how data sharing shapes digital health innovations. Mainly, I think what I observe is that in the paper, data sharing improves for innovations, access to data. And digital health innovation startups, when you think about them, they are not really of the same category, because different startups cater to different requirements within the health sector. So some are focused on child and maternity health, some are focused on senior citizens' health, and some are focused on preventive or even mental. So their requirements of the kind of data they need is very different. And what national level data sharing through electronic health records does is give them access to the type of data that they need. And secondly, when startups and governments collaborate by means of electronic health records, it's a win-win situation for the two of them, because for the governments, it gives them a clear understanding of what potential and risks startups pose to the healthcare ecosystem and how they can best mitigate it and even enable it through by means of policies. And for startups, it enables them to scale better to the mainstream healthcare by means of their solutions. Secondly, we increasingly saw that many countries are, except for China, which is a different model, of course, other countries are implementing regulatory sandboxes, which are pushing innovations to scale to a certain extent. Because in the absence of a regulatory sandbox, what basically the scenario is that startups don't have a clear picture about the current regulations they need to comply with, especially when they are collecting personal health data of patients. So EHR integration, on the other hand, enables them to get a clear picture of regulations, as well as get certified by the government as a service provider, which enables them further when they're engaging with their clients and stakeholders to further expand their solutions. Secondly, in the absence of a national health record system, what happens is digital health startups in particular, if they are not aware of the regulations, then they are worried if what kind of costs are involved when they comply, when they collect health data or they provide consumer-facing solutions. On the other hand, if they are integrated with the national electronic health systems, they are able to provide more consumer-facing solutions, which means they are able to access more patient health data to a certain extent, even in an anonymized manner if need be, but that helps them to evolve their solutions better. Now, at the cross-border levels, there remain several challenges in Asia across countries. Concerns about data misuse is key, which makes innovation very cumbersome through and through across healthcare system and across countries. This is the case because there is firstly the nature of healthcare itself, which is very facility-based. Many stakeholders shared this with me that healthcare still has to evolve out of that facility-based care model towards a more online-based care model. A good example of this is what China has achieved in terms of internet hospitals, where they have triaged online healthcare with facility-based healthcare. That is still not the case for most countries across Asia. Secondly, data sharing restrictions especially limit innovations to scale, because if there is a given innovation, say in India, for example, and they want to scale to China, a challenging market to some extent, given the regulations. So it becomes very difficult, almost impossible, because the government doesn't allow or restricts data access to foreign stakeholders, as well as data sharing across borders is highly regulated or restricted. So that makes it difficult for startups in other countries to scale to new contexts. And lastly, and most interestingly, a contrast that appears in this paper is that governments across Asia are discouraging data sharing, cross-border data sharing, but at the same time, they are encouraging innovations to cross borders, which is pretty contradictory and very special to healthcare, so to say. And this is not commonly observed in other sectors, I believe. So that is one. Now we'll talk about how this situation can actually be changed and in what ways. Some of the common factors I've identified across three categories. At a macro level, we can say that there is a need for global health data governance and a need for establishing a coordinating organization, at least in the Asia level, under the UN or the WHO, to enable cross-border health data sharing. Next is for health data to be actively recognized as part of cross-border agreements at bilateral, regional, or even multilateral levels, because currently data is recognized as an umbrella term and health data is not clearly defined, and what are the protocols for sharing health data in any case is not mentioned as well. The meso factors or the country level factors for digital health innovation would be, to begin with, I think, in Asia, it's necessary for governments to invest in digital infrastructure consistently across the country, because there remain significant urban-rural differences, provincial differences, and even sub-regional differences at times in terms of digital infrastructure. And most importantly, I think amongst all the other factors remains the successful implementation of electronic health records at a national level, because that in and of itself will be a significant catalyst in enabling digital health innovations at the national level. At the micro level, we see for organizations, it's important that they invest actively in improving their health IT systems, in addition to developing tech talent within healthcare. This can also be like in-house training of professionals in digital health, or they can also train healthcare providers to actively adopt digital health solutions at a hospital level. In addition, it is essential for hospitals to put in place data security measures so that they are not vulnerable to cyber threats going forward, which is a constantly evolving threat. And moreover, it is important for hospitals to actively participate in government initiatives, as well as partner with digital health startups, so that they are able to benefit from the digital health innovations that are emerging in the private sector, as well as what the government is enabling. And in terms of future directions, there are three aspects, on three fronts. It is important for businesses and policymakers to be updated. Firstly, it is technology developments, because especially for artificial intelligence, what we are seeing increasingly is that artificial intelligence is completely disrupting the healthcare landscape in a way that is pretty unprecedented and very fast. It is important for businesses to keep updated on how the kind of technology solutions startups are adopting. I'll give an example of some of the startups I came across. They are trying to implement AI-based federated data platforms. This is one of the technologies which does not require data to be shifted away from the facility, but at the same time, they are able to use data for enabling digital health innovation. So this is a very interesting area of development. We are also seeing others like use of synthetic data, where AI is basically able to mask the personal details of a patient and thereby still make the data usable for innovations without being restricted by regulations. Secondly, it is important to understand the regulatory landscape, because I think across Asia, there is a lot of diversity across how governments are developing and implementing data protection and cybersecurity policies. And many countries are still developing them or are in the process of implementing them. And as a result, I think this particular landscape is going to continue to evolve as more and more countries put in place these policies. Also, in terms of health data standards, I think not all countries are equally adopting health data standards to make health data sharing possible in the first place. So it is also important to understand what are some of the regional dialogues that are going on in terms of health data standard adoption at a national level, and what exactly countries are doing to enable that. And lastly, the global landscape. I think a key development I would like to highlight is WHO's recent digital competency framework for member countries, as part of which it is possible for member countries to assess how well they are prepared in terms of digital health capabilities, as well as in the future when it comes to data sharing. So this, as well as the recent G20 declaration on enabling global digital public good, enabling global health data governance and using digital health data as a global public health good, is also something to be considered and followed. Thank you very much.
Great. Thank you so much, Aarthi, for this very comprehensive presentation. Before we get to the audience for questions, I just have one for you with regards to what you mentioned about the importance of the regulatory environment. You also mentioned this briefly in your presentation, which is, what about the public perceptions and acceptance of cross-border sharing? How have governments in Asia worked to build this trust and ensure that the public, with regards to their health data, is being used responsibly? So what are some of the government initiatives in terms of boosting and ensuring that there's a level of acceptance, and as well as along with public awareness that the health data is being used responsibly?
Yes, so I would like to highlight some of the developments that is kind of opening up the public mindset on data sharing. Firstly, I think some of the successes of what the financial sector has seen in terms of fintech has kind of opened up, the perception on what health data sharing can do in terms of service provision. So why I highlight the finance sector is because many of the times, some of the frameworks that Digital Health in Asia adopts is from the successes of the fintech sector. So that is the same to some extent for citizens as well, because they see the successes in the fintech sector, and they kind of try to use that framework to understand what the potentials are for digital health data share. That is first. Now, secondly, I think the private sector has been far ahead of the public sector in terms of developing digital health solutions, which has kind of been riding on the adoption of increasing adoption of smartphones and digital tools by citizens. So what I'm trying to convey is basically people have in-hand experience during COVID-19 of what digital health tools did for them, especially in terms of access to healthcare during national lockdowns, access to doctor consultations, even medicines which they could order from their mobile phones. So all this has kind of created a ripple effect in terms of perception for citizens. That is one. Now, government is actually late in catching on, because it is kind of, if we look at India and Indonesia, it's pretty late, but still the government is catching up on this wave of changing perception and building national electronic health records. And they are actively conducting ground level awareness campaigns, especially for citizens to understand that the government is trying to build something meaningful for them, something because, for example, one thing they are trying to cash on is that if you don't have digital health, basically, you'll be carrying around, huge files of health records when you go from one facility to the other, when you're moving from primary to the secondary healthcare services. It's an increasing and a big challenge for them. Also because cost-wise, if there are no health records, patients are required to retake tests from one facility to the other. Although they already have those results in place, they don't, hospitals make them to go through those tests all over again. So these are some of the common barriers that patients face in person, and the government is cashing on trying to use that to make them understand the benefits of digital health at a national level. Of course, what we see is in the urban areas is very different. The urban tech-savvy population is very quick to catch on to the benefits of digital health. But however, that is not the case for rural populations who still rely on facility-based care, and they want to have a face-to-face conversation with their doctors, and they are comfortable with carrying files and things like that. So Asia is very diverse in that sense. Yes.
That's very interesting. That's actually, I have just a follow-up question on what you mentioned about the access in terms of the urban and the rural. How when it comes to health innovation, which is really, as you have indicated in your report, is achieved through greater cross-border flow of data, of health data. How are countries in Asia to ensure that there's this equitable access to these developments? I mean, are there a strategy in place to ensure that the rural and more impoverished groups or places can also benefit from these innovations?
So what actually is happening in Asia is kind of cross-learning of best practices in a sense. So some countries have been very successful in kind of providing comprehensive universal health coverage, as we talk about, and also kind of taking digital solutions to the last mile. The case of internet hospitals in China is a great example. Then we also see that over several years, telemedicine has actually caught up across several countries. So what this means is that when certain countries are seeing success with certain technologies and tools, these developments are being actively discussed at the regional level. So that can be, the ASEAN digital ministers meeting, where they discuss how some of their own best practices have shown good results, and that other countries want to adopt them or want to learn from them. The Asian e-health network, information network, or AHIN as we call it, it is another grouping, important grouping in Asia, because what they do is basically try to bring to the table some of the best practices and successes that have been achieved, not even at the country level, even at the sub-regional or provincial levels. And this helps other countries to learn from them, as well as adopt those tools. There is also constant engagement by organizations like JICA, for example, who are also kind of creating awareness about digital health at the ground level when they are investing in health systems. Then that is one case. In the private sector, we also see large organizations creating awareness campaigns for the public. There are multilateral institutions, who are working actively, like the UN Development Program or the USAID. I hear from Indonesia that USAID's programs in Indonesia, they also have a digital component, because they want to ensure that the volunteer workers who are going to the last mile and collecting data, it is easier for them and more efficient for them through digital tools instead of using paper-based solutions. So these kind of, because when we look at health as a whole, it's both an integral part of the economy. At the same time, it's very diverse and multifaceted. And there are a large group of players involved in this, including right from, I think, the primary healthcare to the hospitals, to the drug pharmacies, drug providers, the supply chain providers, even the insurance players, as well as, you know, the drug companies, many of them, the technology companies, as well as the digital tech specialized companies, cloud service providers. There is a whole gamut of players who are playing their role in different ways. So there are multifaceted engagements in the region going on, and that is kind of pushing awareness about digital health, its benefits, in addition to what people are facing in hand, you know, like what they are, the kind of apps they are using for digital health services, or, you know, the platforms they're using to, you know, store their healthcare records and share it with their doctors. All of this is coming together in a very interesting fashion in Asian context.
Great. Thank you so much, Aarthi. We have a few questions from the audience, which I will read out. So we have a question from Joanna Wu from Johnson & Johnson. How should we ensure data privacy as we engage in cross-border health data sharing?
Yes, so actually, you know, data privacy requirements have pushed technology companies to come up with several unique techniques and tools. For example, anonymization. I think anonymization, we shouldn't understand it just like, I think, anonymizing personal data and the remaining data is shareable. I think there is also concern or skepticism that even anonymized data can be re-identified, you know, if tried. Like, it's not, anonymization is not a complete solution. Then there are techniques like encryption. So encryption does work, but then there are critics who challenge that as well. Then we talk about the blockchain-based solutions, you know, which basically completely make it impossible for anybody to get a hand on the complete set of data, which means the data can be safely shared across borders or between institutions. So there are several techniques that are currently evolving, and then that are bound to evolve going forward. But what is more important, I think, is for the key stakeholders in the healthcare system to be aware of this, because currently what the scenario in Asia is that I think the highly developed economies, the governments who have in place, government tech kind of institutions, they are well aware of these developments in the public sector. The private sector, of course, is very well aware of and updated about how these technologies are evolving and what are the new technologies that are coming up. But in the real gap remains with the hospitals, with the last mile primary service providers, because they are not aware of these solutions. Even now, across Asia, I think the key challenge remains that health data is still stored in paper form, in the paper-based. It's not yet completely digital. So, and the digitization process has kind of just started in many of the countries. So what we see is when I talk to these stakeholders, some of these stakeholders about cross-border data sharing, they can't really fathom the idea of whether this is even possible, like whether the government will even allow them. Because even now, we do not have at the country level a comprehensive digital format of the data. It is still partly physical, partly digital. So that makes it challenging. Also, the healthcare is not very updated on the latest technologies. And it costs them a lot actually at the hospital level to hire technology experts to retain this talent and to kind of digitize their existing data put it on the cloud and to secure it efficiently before it is shared. So these are the real challenges. Of course, what needs to be done is, of course, at the hospital level and more comprehensively at that. And government is a key player to enable this by means of the National Electronic Health Records, because what they are doing basically is creating an umbrella framework to which stakeholders can basically, a platform to which stakeholders can onboard. And the government kind of brings together all the solution providers from the tech sector to the key players like the public hospitals, the private hospitals, and the clinics on the healthcare sector onto the same platform, so that there is an exchange of knowledge and solutions. So once this is successful, I think the translation of data security tools to the healthcare sector will be more efficient.
Thank you, Aarthi. We have another question from Chandra at Advanced Biomedical Instrumentation Center. Chandra asks, is there any quantitative KPIs for each national electronic health recording system?
Yes, so actually, there are frameworks that usually governments refer to in terms of health data standards. There are several, actually, Chandra, there are several existing frameworks when it comes to how national electronic health records should be implemented. And however, the challenge here is that most of these frameworks have been developed in the European context or in the American context, we can say the developed West world context. So while governments do refer to them in Asia, to kind of take the best practices from them to implement their own national health records. However, there is kind of a skepticism among governments on whether they should blindly adopt this to their context, because it may not necessarily work as well in the Asian context, given their own healthcare gaps and challenges. So that is one. Also, the KPIs kind of, the mention of it helps me refer back to the WHO competency framework. I think the presence of a common reference point, the KPIs for national electronic health records, is actually a gap, which Chandra rightly referred to. And the WHO also identified this. That is why I think they have come up with the digital health competency framework. So what the framework basically does is, I think national electronic health records per se is not an independent platform, because there are other factors involved. So what the WHO is trying to do is trying to bring countries who are at different levels of digitalization to bring their healthcare sector to a common platform of competency, so that they're ready to apply national electronic health records at a national level. And then the framework will kind of enable a comparative analysis of what countries are doing based on a common set of KPIs. I think that is what is the intention behind the competency framework. I'm very sure that there are several other interesting frameworks out there, and I've heard about it on some of the forums, but I'm not able to readily recall many of them.
Thank you.
Thanks. I think we have some time for one last question from Dean at Changing Ground Project.
My question gonna be, because now we know the more foreign investors very interested in investing in China, but nowadays we know there is some policy that always changing, keep changing. So when you analyze from the investors perspective as a key stakeholder, do you have any analysis more on this part, and what's your recommendations when you analyze the geopolitical situations?
Yes, actually, in my paper, right, how I looked at the country case was what China is doing successfully at the national level. I think I'll go from that to the global factor. Firstly, I think what China has successfully done is kind of creating a very successful policy roadmap. The roadmap basically means it's a long road, and they have consistently implemented policies to enable the healthcare sector to digitalize in a systematic manner. Now, that is definitely showing results in the sense that I think the hospital IT systems, particularly across China, are in an advanced stage, and those that are not are trying to come to that stage, because they want to continue to get government funding for many of their projects. So that is the scenario. Secondly, what China has another aspect China has successfully done is to create a less restrictive market, at least for the local players. Now, what that does is basically it has created a very interesting ecosystem where the turnover time for a startup idea to come to as a product into the market has significantly reduced, which means there is a lot of competition in the digital healthcare sector, which has created a scenario where new and interesting solutions are coming up. Now, what I mean by this is when the regulatory environment is less restrictive and there is adequate competition among startups with new ideas, it creates a perfect environment for deep tech innovations. Deep tech innovation means innovations that are completely disruptive for a given sector. So that is what the Chinese innovation ecosystem looks like in the healthcare sector. Now, Chinese policies, of course, the policy frameworks are very different domestically and externally. So externally, I think the factors you mentioned rightly, Dean, is that the US-China tensions as well as other global developments are kind of pushing the government to very carefully navigate how they control cross-border data sharing. Now, that is, of course, the government's own contextual decision and how they want their own priority, the decisions they take based on their own priorities, which is I think only they can decide. But of course, that I feel that is not completely affecting or even affecting at all the domestic innovation ecosystem, because what investors really want to see is they want to see their investment be, kind of pushing forward with new innovations, successful innovations. They want their investments to reap benefits, and that happens in case of deep tech innovations, which we see in the Chinese context. So I think that keeps that domestic innovation ecosystem keeps the investors always coming back to invest and in those solutions, and that is completely kind of cut off, or the investors choose to kind of ignore sometimes the geopolitical tensions out there.
Thank you, Aarthi. Just a very final question from Charlie Humphreys. Charlie, please.
Thank you, Zuchan. Aarthi, thanks so much. Very, very interesting. Just a very quick one. You talked about the cross-border data sharing. We follow a lot of trade agreements, FTAs, regional agreements, ASEAN. How likely are these to make a difference, or do these data sharing agreements really need to be done in a much more precise way? For example, like Singapore's digital economy agreements, kind of built into wider trade issues, basically.
Yes, there is definitely a lot of potential for that. But Charlie, the real challenge remains in, I think, let me give you an example of the ASEAN Digital Ministers meeting, for example. That is precisely where I think recently they discussed about the potential for health data sharing at a regional level. And it is still in the discussion phase, and there is no real concrete outcomes of the discussion or action points, which countries may take. Why this usually happens is because I think when we talk about health data, right, it's not, data is different and health data is different, like definition wise. And I don't think governments do that currently. When they enter into agreements, when they are negotiating agreements, and when they are actually putting things on paper, they are not defining health data separately or as a component and as a component which will be operational in certain circumstances. Like they don't define health data, and they don't define the process by which health data will actually reap benefits for the economies in the region. So they don't really do that properly. I think what they are currently doing and the stage they are in is to kind of regulate data as an umbrella term. And even if they are even in cases where they include health data, that is in a very minor way and in a very ambiguous way. So which means The reason for that is, health data kind of is like a core asset, which countries treat it like a core asset, or they treat it like, that is what I said when I said, like, governments are looking at themselves as custodians of citizen health data in particular. They are very sensitive about it. And you'll be surprised to hear that in the healthcare sector, stakeholders are even more sensitive about it. They don't even want to consider the potential of them sharing data between hospitals. Like certain country context, that is the situation. So you can understand that when it comes to government and the kind of responsibilities they carry towards their citizens, they are very skeptical, because most of these governments rely on the voting process. They cannot make huge blunders. Even I'll give you an example of even Singapore's data breach, right? It almost threatened a very well-established government. It completely shook the popular opinion about what the government is doing with health data of citizens. And even during COVID-19, you would be well aware, right, what happened with the digital contact tracing applications, and how the response of citizens was very different with respect to health data, something you would not see in other sectors. The financial sector, for example, we are seeing fintechs evolving like anything in Asia, the adoption being very rapid by citizens. There is active kind of collaborations happening, the data going all over the place. Like, I think even my financial data would be stored somewhere in Europe or America, and it doesn't bother me. So, but that isn't the case in case of health data, I think. Healthcare sector in Asia particularly is very sensitive about it, and governments are responding to these sensitivities and not actively discussing health data as a shareable entity. That is what I see. So I think it will take significant time for even health data to be defined in these agreements. It will over the years in the Asian context.
Thank you all very much for this very interesting conversation. I'm afraid we're running out of time. I'd like to thank Aarthi's contribution and our audience for your participation and involvement. Cross-border data flow is a significant issue that will impact many sectors of the economy and businesses. We at Asia House will continue to closely monitor the development as a part of our wider research agenda on digital economy. And the best way to follow our research is to sign up on our mailing list and follow us on social media platforms. Please do feel free to get in touch if you would like to find out more about Asia House and Asia House Research and Advisory. Just a final word on our annual fellowship program. We have recently opened the application process for the 2024-2025 cohort. The deadline to apply is 31st of January 2024. More information can be found on the Asia House website under fellowship. Thank you all again. Goodbye.